Good afternoon. It's a rainy day, but it's a nice day. Happy Tuesday, and thank you for tuning in at 1 o'clock. Tomorrow's briefing, to remind everybody, will be at 2:30, and then every day thereafter at 1 o'clock. Usually I begin by thanking all of you for tuning in, and I will do that, and thank you for keeping yourselves informed. It's one of the best things you can do during this crisis. But I do want to take a minute to thank the members of the media. Like many of us, they too have been working overtime. They've been giving us a lot of good information around questions people are asking. We've been trying to answer those questions, and I know this format is far from ideal, and you've been working with us, so thank you for all the extra work, and thank you for keeping Rhode Islanders informed. I will say the amount of misinformation flying around on social media is probably getting worse, not better, or at least more voluminous, and so your role as responsible journalists is more important than ever. So thank you for what you're doing. Okay, a bunch of announcements today. I'll go through them all as per usual and then come back to answer questions. You can see the data on the screen, which will indicate to you that our cases, unfortunately, are still rising, not declining. Pretty steady, which is the good news. Clearly, we are flattening the curve. Clearly, the peak isn't going to be nearly as bad as what it could have been, which means that all of your hard work in obeying the stay-at-home order is really working. It's absolutely working. It's saving lives. It's preventing our healthcare system from being overwhelmed, and it's going to make it so that we can all get back to work sooner. So I want to thank you for that. Having said that, you'll see more cases today, more today than yesterday, 394 today. So we're still not leveling off, but I am hopeful. I hope that we'll start to see that soon. As I mentioned yesterday, and as I've mentioned almost every day, my goal is to reopen our economy as soon as possible, but as safely as possible. And when I say as safely as possible, I mean reopen the economy, but getting rid of the risk that we might again see another surge. We might see outbreaks, but we hope that they will be smaller, more manageable, quickly identified, and we can deal with them. But we never again want to be in a situation where we see this full-blown surge and we have to shut everything down. And as I've said, due to your hard work, we've really done an excellent job of kind of bending the curve or flattening the curve. Having said that, it's still a scary time. It's a scary time for everyone, and I have a feeling that although I'm now saying you have to stay at home until May 8th, and I'm very serious about that, we absolutely have to stay at home. It is not time to take our foot off the accelerator. If we do, we risk going backwards. But pretty soon I'm going to be saying to you, let's be brave together, and let's get back out there under a safe set of circumstances. And so I'm just trying to orient you to where we're going to be going, hopefully a few weeks from now, assuming that we continue the positive trends that we're seeing now. And yesterday I spoke about the 6 indicators that I'm using to measure when we can reopen the economy. And I mentioned that one of the indicators was making sure that we had enough personal protective equipment for all of our healthcare workers, and actually for everyone. I suspect we'll be going into a new normal where you're going to have your temperature checked before you go into work. You're going to have to wear a mask while you're at work. And especially for healthcare workers, we have to make sure they have enough masks and gowns and goggles and gloves and such in order to be able to do their jobs safely. And so we're really working incredibly hard to make that happen. Our goal is to have a 30-day supply of PPE on hand at all times. Not quite there, but moving in that direction. For me, one of the hardest things to hear, I end my night every night by reading through a lot of the notes that people send to me. And by the way, many of them are heartbreaking these days. But some of the hardest stuff is from frontline healthcare workers who say they're afraid to go to work, yet they are going to work. They know they have a duty to serve as a social worker, therapist, nurse, certified nursing assistant. But obviously they're anxious, and on top of it, they're having to reuse their surgical mask or their PPE, for too many days. At the end of a long day, they put it in a bag and have to reuse it again the next day and the next day. And that's really tough to hear. And so you shouldn't have to do that. We can never thank you enough, those of you who are in the healthcare system and continuing to go to work, showing up faithfully, even though you're scared, in a nursing home, in a congregate care setting, in a group home, working with the developmentally disabled. Of course you're afraid, but you're heroes, you're brave, you're doing it, and we can never thank you enough. What we can do is work harder to make sure that you have more and better protective equipment to keep yourself safe. So I have a bit of good news to share, which is that in the past 2 weeks, we've received shipments totaling more than 1.5 million surgical masks, 90% of which has come from the private market, by the way. Everybody says, oh, the federal government's supplying everything. These masks we have had to scour the world for and purchase on the private market. And we continue to do that, by the way. That brings our total on-hand masks as of today to just about 2 million masks. So that means that healthcare workers across the state, in hospitals and nursing homes, urgent care centers, primary care offices, other areas of congregate living, can now change your surgical masks on a daily basis. I realize that's slight consolation, but it's improvement. It's an important sign of hope that at least now you can get a fresh mask every day, and it's a signal that we care for you, we care about you, we're grateful to you, and this is just the beginning. It's going to continue to get better as we continue to get better at resourcing you and these settings. And I know we need to do more. If you're an eye doctor, oncology center, diagnostic centers, we have to do better by you as well, and we will. The supply is opening up. We have 2 million now. We have many million more on order. The same thing for the N95s and the gowns and the gloves. And I hope that, in the next few days or a week, I'll be able to make more announcements of greater purchases of PPE and our ability to distribute this even more widely. I also want to make a special note about the field hospitals, which as of today, 2 are ready to be operational. I have to give I can't say thank you enough to General Callahan at the National Guard, who's just been a rock through all of this. His leadership has been outstanding, and in particular, standing up these field hospitals has been nothing short of extraordinary. Similar thank you to the EMA and those workers. A huge thank you to the Rhode Island Convention Center for your collaboration and cooperation, and also to the owners of the Citizens Bank building in Cranston. I have to thank Dr. Tim Babineau, who's the CEO of Lifespan, and Dr. Jim Finale, the head of Care New England. You and your teams have been outstanding, and I can't thank you enough. I want everyone in Rhode Island to understand what has happened here. A few weeks ago, we were looking at models which showed that we were going to need potentially 6,000 or more hospital beds at the end of the month of April. I think all of us walked around every day, all day, with a pit in our stomach, looking at these models, looking at the reality. How are we going to do this? How can we possibly get this done? I personally was on so many phone calls with Dr. Finale, with Dr. Babineau, with General Callahan, pulling our hair out. What are we going to do? How are we going to do this? This isn't possible. How do you build a hospital in a few weeks? It should take 6 months. And they did it. They did it. I had the opportunity to walk through these field hospitals, and it's nothing short of a miracle that they got it done. And to all the men and women who literally worked around the clock to make it happen, I can't thank you enough. Due to the collective efforts, there's an additional about 1,000 beds in these hospitals that are ready to serve Rhode Islanders should we need them. And we call them field hospitals. That's the nomenclature that the federal EMA uses. But these are not, crisis care standard type hospitals. Obviously, it's in a convention center. It's not a hospital. But they're places you could get better. And we also have staffing plans and staffs available at a level where you could get better. So thank you. I sleep easier at night now knowing that if there is a surge, if at some point in the future, God forbid, we need these hospitals, they are there. They are ready, they can be staffed, and they are top-notch. So thank you. Because of the great work of the people of Rhode Island in obeying our stay-at-home order, we don't need these now. And we may, praise God, we may never need them. But if, when we reopen school, there's a surge, or we go back to opening the economy, or we see a seasonal change in the fall, as some predict, and we do need them, I want you in Rhode Island to know they are there, they are staffed, they are top-notch, and we will take care of you and in the best way possible. With respect to staffing, while I'm talking about staffing, I want to make another plug for the Skills for RI website. So right now we have many, many people who are out of work, and that's something that we need to get to the business of fixing as soon as we can. But we also have thousands of openings, particularly in healthcare, grocery stores, other essential services, where these employers are desperately looking for workers. There's a lot of organizations who are trying desperately to fill open positions as fast as they can, and we know we have thousands of Rhode Islanders out of work. Skills for RI, skillsforri.com, is a matching website that we set up about a week ago, and I would ask anyone who's looking for a job, who wants to work now, who wants to get paid to work, go to skillsforri.com. There's thousands of jobs available. Check it out and apply for one. If you're an employer who's struggling to find folks, you also can go there and put your search online. Continuing on the theme of supporting our frontline workers, I want to revisit the topic of providing safe housing and shelter for our frontline workers. Again, as I listen to Rhode Islanders, and I try to listen to as many as I can every day, you hear from people who might be a police officer, caregiver, home health care worker, some nurse, and they're afraid to go home. They're constantly exposed, they think, potentially, to the virus. They have a busy, large family at home. Maybe they're living with their mother or grandmother or older aunt and uncle, and they're just afraid to go home because they don't want to spread the disease. And so we've been working hard to provide options for these folks to live safely, have a safe place to sleep at night. Last week, we launched rihavens.com, rihavens.com, and that connects frontline workers in need of a place to stay with hotel rooms. And there's a variety of hotel rooms. Some of them are as inexpensive as $25 a night. Thank you to Hotels and the Hospitality Association. And others are obviously more expensive. Having said that, even at $25 a night, that adds up if you stay there for a few nights. So I've been working to try to find free options. And I'm very pleased to announce that as of today, we've partnered with Brown University to provide free single occupancy dormitory housing to frontline workers. Brown has made more than 700 rooms available to the state for free. Thank you, President Paxton, thank you to your team, and thank you, Brown University, for stepping up without hesitation in Rhode Island's moment of need. It's fantastic, it's extraordinary. Not every university and every state is willing to do it, and your team has been such a pleasure to work with. Now, anyone who's ever lived in a dorm room knows this isn't exactly a five-star hotel, but the rooms are basic, they're clean, they'll be cleaned daily. It's single occupancy living. Brown has arranged for laundry service and food service that you'll obviously have to pay for additionally. Bathrooms are, in most cases, communal, but it's a free, safe, clean place to stay if you're a frontline worker who either can't go home or is afraid to go home and needs a safe place to stay. Again, I have to thank my team. As you might imagine, setting this up is a logistical challenge, to say the least, and they did it. In just a few weeks, 700 rooms available for free for the people to whom we should all be the most grateful right now, which is our frontline workers and first responders. Let me say, I'm sure there's going to be a lot of questions. Who can use it? Who can't? How do you sign up? So this is for frontline workers. These are for folks who can't stay home right now. They have to go to work. So that is any medical personnel, any first responders, any members of public safety, any nursing home workers, any congregate care workers, so that's group home settings or any other settings, any home care workers, anyone in a position of providing direct care and service, and like I said, is either afraid to go home, can't go home, this is available to you. This is not for people who have tested positive for the virus and need to be in isolation. That's not what this is for. And as I said, there are communal bathrooms, so this is not a great place for isolation. Workers who are, if you're listening to me say this and you think, that's me, I live in a crowded household, I have some elderly relatives, I need a good night's sleep and I'm afraid to spread my germs, this is for you. You should talk to your boss about it. We are going through all of the first responders, nursing homes, home care agencies, et cetera, to make it available. And you can ask them and they can tell you how you can sign up for a room and we will make that room available to you. If you have coronavirus, if you've been tested positive, you do need to isolate. And if you are housing insecure, or just, you don't have a place you can isolate, then you have to let us know. You can call the Department of Health, and we will help you find a safe place to be in isolation. Which leads me to my next point, which is the Wyndham Hotel in Warwick. So we have leased the Wyndham Hotel in Warwick for the purpose of safely quarantining and isolating people who are housing insecure. But we're getting a lot of calls from people in the homeless community and otherwise just looking for a room at the Wyndham. Unfortunately, that is not a service that we are able to provide right now. We're working overtime with the housing community and homeless advocates to try to take care of everybody, but the Wyndham is not for that. In order to be able to have a spot at the Wyndham, you have to be directed by the Department of Health to go to the Wyndham. So the Department of Health will make a determination and they will decide if you get one of the rooms at the hotel. Sorry if it's confusing, but at least from where I sit, none of this was available a few weeks ago. We had no field hospitals, we didn't have the Wyndham, we didn't have 700 rooms at Brown, we certainly didn't have enough PPE to tell everyone they could not have to reuse it. And in a very short period of time, we're building a system that should give you confidence. So that when we get back to the business of emerging from our homes, I want you to have confidence. We're not going to do that until we feel ready. And all of this should give you some confidence that we're building a system so that when we get back to work, we will be ready and we will do everything we can to keep everybody as safe as possible. Until that happens, sadly, and of great distress to me, is just how devastating the economic impacts of this virus have been on our economy. It keeps me up at night. I'm sure it keeps a lot of you up at night, not being able to pay the bills, not knowing how you will pay the bills. We've had 170,000 unemployment insurance claims filed in the past 6 weeks. That's never happened before in our state's history. It's truly unprecedented. I'm going to tell you today what I told you yesterday. We're going to get you all back to work. We are going to stand this economy back up together. And we're going to do it as quickly as is safely possible. But in the meantime, we're also going to make sure you get the support that you need in order to get through it. Because it's going to be a while, and when it comes, we're going to reopen in waves incrementally. So I'm very proud of the team at DLT. I don't know how they're doing it. They're doing better than any other state that I can find. We were the first, or one of the first states to start processing the pandemic unemployment assistance. We are processing claims faster than almost every other state. And somehow they're doing it with a system that is very old, technology that is very old, and frankly, a system that was not built to process 170,000 claims in a few short weeks. So to Scott Jensen and the team at DLT, man, we can't thank you enough. I receive notes every day from people who are desperate to get those checks. And I want you to know, Scott, that we appreciate all the endless work that you're putting in. To that end, we had a big breakthrough over the weekend. As you may or may not know, when you're on unemployment insurance, the federal government requires you to certify on a weekly basis that you're still unemployed and therefore can get your checks. Typically, that happens on a Sunday. So on any given Sunday, the system is overloaded with phone calls, people calling in at the end of the week, the beginning of the next week, to recertify that they're still unemployed. Now, many of you hearing me are probably saying, yes, Governor, we know, because when we call on a Sunday, all we get is a busy signal. Or you can't get through, or you're frustrated, and I'm sorry for that. Here's what I can tell you. We have upgraded the system. We've moved heaven and earth to work like crazy over the past couple of weeks. We've upgraded the system with the help of Amazon Web Services to have very enhanced technology. And on account of that, this past Sunday, 2 days ago, we were able to recertify 75,000 people the moment they called in. People didn't have to sit online, and there wasn't a busy signal. So hopefully that was your experience on Sunday. You didn't have that busy signal, and I hope that that'll continue to be your experience, that you won't get the busy signal, because we're able to process tens of thousands of calls every day on account of the Amazon Web Services upgrade. I also have to thank BJ, who's the state CIO. BJ and his team are unbelievable. One of the efforts that we've made over the past couple of years in the state and my administration is to really beef up and professionalize the state's IT department. And under BJ's leadership, we've done that. And things like this couldn't have happened a few years ago. Now they're happening. And I want to thank you for all of your hard work. By the way, it doesn't mean you're not going to have to wait 7, 8, 9, 10, 12 days for your unemployment insurance check. I'm sorry, that is still the case. We're doing our best to make that happen in a more expedited fashion. I want to end on a positive note. As I said, I get lots of emails every day, lots of people reaching out in all different kinds of ways, and they come in a couple of different varieties. Many of them are, Governor, please help. Help in some way or another. The level of suffering is pretty high right now, hardship, and I love hearing from you, and everyone we hear from, we do our very best to help. And then on the other side, there's lots of really heartwarming stories. People going out of their way to offer help. How can I help? You know, people sending us homemade masks. Thank you, Rosa, in the Department of Health. She gave me another installation of gorgeous homemade masks, people giving us money, people delivering food, people offering me suggestions and ideas. That gets me through the day, and it gives me confidence and hope that Rhode Islanders are a resilient, confident, hopeful people, and we're going to get ourselves through this. Yes, we get frustrated, but we are together going to rise above that frustration and do the right thing for one another and for our community. So today, I received the following beautiful note. It was actually a note that was sent to the Rhode Island Foundation and forwarded to me. Today, the Rhode Island Foundation received a $1,200 personal check for their COVID-19 response fund, along with this note. Here's my stimulus money, which others need even more than I do. That's exactly the spirit that's going to get us through this. So thank you for doing that, and it inspires me to keep doing my best for all the people of Rhode Island. So with that, I'll turn it over to Nicole.
Thank you, Governor. Thank you for that update. Thank you all for tuning in. I want to also echo the Governor's appreciation to all of those who have been generous in this time, knowing the assistance that's needed, and also a special thank you to Rosa and Aunt Lydia for the beautiful masks that were given to the Governor and to me. So as usual, I want to remind everyone that the data the Governor referenced is all available on our COVID-19 data dashboard on the website of the Rhode Island Department of Health. Of the 16 new fatalities that we are unfortunately reporting today, 6 of them occurred yesterday, and 10 of these fatalities occurred in the days leading up to yesterday. The age distribution for the 16 people whose passings we're reporting today is 1 person in their 30s, 2 people in their 50s, 4 people in their 70s, 3 people in their 80s, and 6 people in their 90s. We want to extend our condolences to each of those families that are impacted. In terms of new cases, as the Governor also mentioned, we have 394 new cases. There are 271 COVID-19 patients currently hospitalized. Since the start of the pandemic, there have been 576 COVID-19 patients who have been hospitalized at some point. 315 of those people have been discharged home. Of the 271 currently hospitalized, 67 are in the ICU and 43 are on ventilators. Our total case count now is 5,500. I also want to note that at the bottom of our data page, we have a link to our historical COVID-19 numbers. As I explained the other day, there can be a lag of a few days between when someone passes away and when it is confirmed as a COVID-19 fatality. In that historical data set online that I just referenced, we have 6 fatalities listed for yesterday, even though the Governor and I announced that there were 16 new confirmed fatalities. So that people have the accurate picture of the arc of this pandemic, we've adjusted the historical data set we have online so it now reflects the date of unfortunate death of each person since the start of the pandemic, as opposed to the date that the death was confirmed. In addition to sharing that data update, I wanted to give a quick reminder about quarantine, isolation, and contact tracing. I'll again say that these are the tools that will be critical to helping us navigate our way out of this as we look to open up the economy. Having the expanded testing that we are doing a good job as a state in being able to access, we want to continue to make sure that we're getting to all of the communities for being able to be tested. And then also being able to implement as quickly as possible the contact tracing and quarantine and isolation elements. Rhode Islanders are doing an excellent job going out, getting tested if you have symptoms, so that we can continue to understand who all is out there and work with you to make sure that the proper steps are taken. When quarantining and isolation can happen, that is one of the most critical ways to stop transmission of the virus from one person to a new case. So many people have told me about their contact tracing notebooks that the governor has charged everyone with doing, where you're listing the 5 people that you've contacted or been in contact with each day. We appreciate continuing to hear that. And so many people are sharing the creative ways that they're continuing to do what they need to do while also closely following the guidelines that we are sharing each day. I say often that everyone has a role to play in successful public health, and it is so true now. One area that we can start to focus on even a little bit more is to really make sure that we're following the quarantine, isolation, and contact tracing guidance right away. The sooner it can be implemented, the more effectively we can stop transmission of this virus. If you're told that you need to quarantine, make sure that you do that right away. It's being able to stay at home and monitor yourself there for symptoms, because it decreases the chances that you are out in public and sometimes unknowingly passing the virus on to someone else. If you have symptoms, it's critical to isolate right away. Safely, but to be able to do that. Sometimes even little lags in time can have huge implications in terms of transmission of COVID-19. And we are doing a good job, but want to be able to share the reminder that if you are asked to quarantine, you should. If you have symptoms, whether or not you have been tested, you should isolate. And it's critically important to tell the people that you have close contact with. Tell the people in that notebook, I'm getting a test because I'm having symptoms, or I'm having symptoms, whether or not you've been able to get that test, so that you can give them the heads up even before we reach out to call. As soon as people understand it's important to be able to stay home, the sooner that can happen, the more effectively we can do as a state in decreasing transmission. So if you have symptoms and you're wondering, go ahead and call your provider and get the process going to get tested. But also, you can start with contacting the people in your contact tracing notebook. Let them know, I'm having symptoms, so I'm going to isolate and stay home and recover safely while talking to my healthcare provider or calling the urgent care center, because you're calling before going to any healthcare facility. But it's helpful to let those close contacts, either people who are in your household or other people who are in your contact tracing notebook or that you know you've been in contact with, to let them know so that they can also start to stay home and be more cognizant of the importance of quarantining. That's something that we can all work on together, and we'll continue to provide the support. And you'll always get a call from the Rhode Island Department of Health, particularly if your test comes back positive. But everyone understanding the importance of that process taking place as early as possible is something that helps everyone as a whole in terms of stopping the transmission of the virus. Lastly, I want to just reiterate a theme I've been talking about for a few days, which is addressing and achieving health equity and eliminating health disparities so that we can ensure that all communities from every zip code in Rhode Island have an equal opportunity to be healthy. The governor and her team, which I'm honored to be a part of, are all absolutely committed to health equity. She's asking me and the other members of our COVID-19 response team every day about what else we can be doing to get resources and supports to the communities where they are needed most. We're going to keep this up as we look forward and start thinking about the new normal and about where we will be in the next 3 months and 6 months and beyond that. We're taking this approach across state government with leaders like Director Scott Jensen, that's been mentioned, Director Hawkins, Commissioner Infante Green, Secretary Pryor, and so many others. We are going to be working with cities and towns and communities as well to help make sure that each step as we go forward takes into account health equity, making it so that regardless of the zip code anyone is from in Rhode Island, everyone has the opportunity to be healthy and to restart our economy with the new normal, bouncing forward to an improved start. I've also spoken about the health equity zones in the past and talked about our Commission for Health Advocacy and Equity just yesterday. These are all partners that we're going to work with together to help make sure that the community's voice is amplified and heard as we work to get Rhode Island back on its feet again in a way that takes into consideration the needs of all communities in the state. So we are committed to that together with you, and thank you very much. With that, we'll get started with questions.
Hello.
Hello, good afternoon.
And hi to everyone at home. We're going to begin with a question from Ryan Belmore of What's Up Newport. What can restaurants, stores, and other non-essential customer-facing businesses do right now while closed in order to be best prepared for the new normal for when you do give them some kind of green light?
Yeah, it's a really good question. So while we don't know exactly what the new regulations will be, and by the way, we're in heavy discussions with restaurant owners and hoteliers and such to get their feedback, hairdressers and the like, there are a few things we do know. We do know that there's going to have to be some version of social distancing for the next year or until we have a virus or a therapy. So start to think about how you can change the layout of your shop or your restaurant. Maybe you're going to have to take tables out, but just figure out a way. The rule of thumb of people being 6 feet apart is still a good one. And so just start to make plans in your own mind around how to reconfigure what you have, whatever you operate, in order to make it so that people can have more space. Similarly, maybe think about, we're almost certainly going to have to do some form of temperature checking. So you might want to think about that, how you would go about that. Think about how you would change your shifts of workers. Again, the world we're living in right now, we're supposed to be now being together with, hanging around with, working with the same 5 people every day. That principle, at some point it's going to be more than 5, but that basic principle is the same thing. You're always going to want to be physically with the smallest number of people as possible. So think about how you can arrange the shifts of your employees so people are with the fewest number of workers as possible. If you haven't already figured out how to do a better job with technology to enable for online ordering, online purchasing, online reservations, now's the time to do that. Call Commerce, 521-HELP. We've lined up a lot of tech volunteers who are willing to help you figure out how to do that, help you make a website, help you do an online reservation system, all that stuff. This is a great opportunity to think about how to tech enable your business, to enable people working from home wherever possible. selling things online, making reservations online. You really want to make those investments now. Think about cleaning. There's going to have to be whole new regimens around daily disinfecting. And you can read up on what's being suggested and how you might be able to do that. So these are just, I think it's a good question. I wish I had the absolute answer for you right now. We're still going through the work, but those are the kinds of things you should be thinking about, if only to get yourself in the mindset and your employees in the mindset of, living in a new normal. Final thing I'll say is, we're going to have to give people confidence. People are going to have some confidence to come out of their house and go shopping, come out of their house and go to restaurants. So the better you do of making your place of work safe, the more likely it is that people will have the confidence to go there.
Our next question is from John DePietro. And John, just so you know, your question did get cut off, but I can read what's on the monitor. Governor, can you address unemployment insurance benefits requiring a buy code to certify weekly benefits? The codes have not been provided and no correspondence has been mailed in regards to eligibility. The call center does seem to effectively process calls.
I don't think I can answer that, but I will get the full question and get you an answer.
Next question is from Tanya Signori of the RI Echo. This is for Dr. Alexander Scott. If a surface has active droplets of COVID-19 on it, then within a 1 hour period, different objects touch it. This can happen 10 times or more. Does the virus then lose its potency? If so, can the virus eventually no longer exist on that surface?
So it's an interesting question, Tanya. We are still learning how robust and how sturdy the virus is. And so your question of 10 times of different interactions, can the virus still be transmitted, is an interesting one. I will certainly say, because of droplet transmission and the concern that a virus can touch a surface, transmission can occur from that standpoint. And what is critical is the environmental cleaning that the governor mentions, and being able to do that on a regular basis. It does have a positive impact, regardless of how many people touched it or what the concern is in terms of the turnover, and the ability to cover someone's nose and mouth with the face cloth covering that we are referring to, and with our healthcare workers, the surgical mask. That helps minimize how much of the droplets that can spew out when someone is speaking or when someone sneezes or coughs. It helps decrease the amount of that then goes onto surfaces. So we know the importance of that type of covering, particularly in a healthcare setting. We know the importance of environmental cleaning, and we know the importance of hand washing. Implementing those measures does impact the virus from continuing on, and that's what I would focus on as a way to stop transmission of the virus.
Doctor, the next question is from Steph Machado of WPRI Channel 12. Researchers at the Cleveland Clinic say they found 15% of Abbott ID Now tests were false negatives. How concerned are you about this? How many of these tests are being done in Rhode Island daily?
So these tests that are referred to are our rapid tests. And it again translates back to the importance of everyone knowing, for all of the tests that we do on these specimens, it is most reliable and most accurate when it's done on persons who have symptoms. That is a key, and that element decreases the risk of the false negative percentage that is being referred to. We are aware of the concern. The tests that we have at our CVS sites that are rapid tests have been verified by retesting at our state health laboratory, and we did get consistent results on the initial set of tests that were done. And what we have with that is similar to what all states are using, and it's the best that we have. It's an important way we have to be able to expand testing. But because of that, we do talk about how to interpret the results. And as I just mentioned, we talk about getting the test obtained in the way that will decrease the risk of having those types of false negatives because you're getting it with someone who has symptoms. But we also want people to be aware that once the test is obtained, if it's negative, if someone still has symptoms, they should still stay home and not go out if they are ill or sick with symptoms to address any of the concerns that we have with test interpretation.
Next question is for the governor. Do you plan to follow Massachusetts and keep schools closed through the rest of the school year?
I haven't made a decision yet on schools. I will be making an announcement later this week. I am still consulting with teachers, parents, employers, mayors, superintendents, trying to gather public health officials first and foremost, trying to gather some more information about what the right thing to do is. It's a tough call. I will say this is a really tough decision. Our children deserve a chance to be able to learn and learn to the best ability that we can offer them. Having said that, it is difficult to imagine how we could safely allow 500, 600, 700, 800, 1,200 kids in a building at the same time in this environment. So we're working on it. I'll make an announcement later this week.
That question was from Elise Major of Providence Monthly. The following is from Ted Nisi. The majority of Rhode Islanders dying due to coronavirus are nursing home residents. How many are dying in their facilities? And are ventilators available there to treat them since they're not in a hospital?
Thank you. This is, a tough question. There's a mix in terms of where the unfortunate deaths are happening. Many are within the nursing home facilities, and a few are at hospitals in those settings. It is rare for us to have ventilators within a nursing home setting. Ventilators are one element of the entire care that's required to be able to have someone on a machine that's breathing for them. And it's primarily done within a controlled environment of a critical care unit in a hospital where someone can be placed on a ventilator. So again, this is a very challenging scenario because it is a very transmissible virus, particularly if it plays out in ways where you cannot tell the symptoms someone has that's leading to the transmission, and it's occurring in a population that is medically and physically fragile. And oftentimes in a nursing home setting, it's within a congregate setting where they are together. So it's something that, as I've shared, we're continuing to be as aggressive as we can. We certainly are working closely with the congregate care setting administrators and their staff, and want the families and residents to know that you are our top priority.
Very similar question to the one before, this one from Barbara Morris at NBC 10 News. We've heard from many people concerned about self-swabbing at the CVS drive-through site at Twin River. Some have ended up in the hospital with a COVID diagnosis after being told their test was negative there. Are you concerned about the false negative results?
This is something we certainly want to have happen as little as possible. It is something that we, as I shared, are doing our best to help address. We want people to know the aspects of the test, that certainly having symptoms is a key to get the best results. And we want to make sure that we can continue to follow closely. So if someone has a negative result, that they understand still staying home and recovering safely and isolating is important to do, regardless of if it's COVID-19 or another. And we're going to continue to follow the outcomes of these tests, and we will make adjustments if we need to with continuing to assess the results.
Alan Gabberty of WBOB Radio asks, why are some COVID-19 deaths presumed? And what is the criteria for classifying a death due to COVID-19? How many Rhode Island deaths are presumed COVID-19 and how many are confirmed?
There are a few ways to address that. Early on, we were using the language presumptive positive because we needed the test that was newly validated by our state health laboratories who did great work getting it going. CDC was repeating the same test, the Centers for Disease Control and Prevention, and that was what we led to going from a presumptive positive to a confirmed positive. What's being asked here is also similar to what I shared earlier. We will be updating our data reports to report people who unfortunately died on the day they died. There's sometimes a distinction between when that happens and when a death is actually confirmed as occurring, and it's less so that the death occurred, but usually the causes take some time to be able to confirm. So we are reporting deaths as COVID-associated deaths, which would identify if there was a positive test associated with someone who passed away. And there is no difference from that standpoint between a presumptive or a confirmed death from that standpoint.
And our last question today for this briefing is from Amanda Milkovits at the Boston Globe. What kind of illnesses are survivors suffering from after they are discharged? Kidney failure or other conditions?
So that's something that we are still learning nationally. Many people have spoken of anosmia, the loss of smell that has occurred with COVID-19 and the time frame that it may take for that to occur. We do know also that this illness is occurring more in people with underlying illnesses, so that may worsen some of the underlying illnesses in certain situations. So if someone had a kidney disease of some kind and were stressed by a COVID-19 illness, that kidney disease may persist or worsen. Outside of those types of associations, we're continuing to learn more about whether or not there are any long-term effects from COVID-19, but haven't been seeing anything prominently as of yet now.
Thank you very much. Thank you.